Welcome, welcome, everybody. Happy Sunday night here in the Washington, D.C. area. Just waiting for a few folks to come on in. We're going to do a 3-point protocol for weight loss and also for metabolism. And we're also going to do some for aches and pains. And then I'm going to take questions. And then we're going to do some really nice acupressure so that you guys get some good rest tonight. So while we wait for folks, we're going to get started a little early today because I want to jump into it, make sure you guys get a really good night. Wanted to, let you guys know you can do this sitting down, laying down. You can do this on a loved one. I'll tell you when you can't do something, if it's contraindicated or whatnot. So you guys just settle on in, get your get your cup of tea, and let's get this party started. Arkansas in the house. Have I ever been to Arkansas? I know Bill Clinton's from Arkansas, but beyond that, I don't know much about Arkansas. Well, welcome, Arkansas. Happy to have you in the house. And I love it when you guys tell me where in the world you guys are from. And the reason why is that I've lived all over the US and I've lived internationally and I've traveled to 3 dozen countries. So I'd love to know where you are. And I'd love to cater the acupressure to your so another Arkansas, Cleveland. Yes, I've been to Cleveland. We have family in Cleveland. All good. Okay, we have a good quorum on here. So first, out of the gate, we're going to do acupressure. And so what we're going to do is we're going to keep it really simple. We're going to do 4 points, and we're going to do it a minute each. And this is going to feel so good for weight loss. And a lot of these points can double up for anxiety and stress. They're going to feel good. So even if you are like, I don't need to lose weight, I look good, then you can do these points to keep your weight and also to help you with anxiety and stress, because we all have it. I'm already dreading going in tomorrow, so we're going to do this. All right, here we go. First point, we're going to go from yin tong, most famous point, to the temple to release the tension along the jawline so that you chew your food and you have no jawline headaches. And then we're going to come here. There's a nice reflexology of little atom right here and right here. So let's go ahead and do this point for a minute. Hey, Seattle. Hey, North Carolina. So this point is really good for digestion. This point is really good for metabolism. This point can really help out the entire GI tract. This point can also balance out hormones because it has yin tong. This point is extremely relaxing, and this point can help you to feel your best self. I always feel so good when I do this point, and I want that for you guys as well. So this is a great point to do as part of your morning routine when you're washing your face. You can also do this with a derm roller. Where's my derm roller? I had a derm roller right here. You can also go upward and do that. So really good thing that you can do with this point. I like to do all my points for a minimum of 2 minutes, but you can do these points much longer. Absolutely. I can't see you, lady. Oh, wow, you can't see? Can you guys see? Can you let me know if you can see? I am doing my best to do the acupressure. Let's see, we're on YouTube. On YouTube, can you see me? On Insta, can you see me? Okay, cool. Thank you so much. All right, next point okay, sweet. Thanks, guys. Next point we're going to do is, yes, okay, we can see you. I can see you. Yes, I can see you. Perfect. All right, next point we're going to do is we're just going to massage the top. The top actually balances out the whole body. It can get to the gut as well. So let's go ahead and do this. And you can also take your nail and you can massage the top like this, and it feels incredibly good. One of the best points that you can do. So I want you to consider doing this as well. Hey, thank you so much. You guys are the best. So if you're just joining us, we are doing a 4-point protocol for weight loss. So why? I wonder what's going on. Can you guys see me? Let me know if you can see me. Earlier it was fine. I'm not quite sure what's happening. If I need to switch to another phone, I totally can. Let me know that you guys can see me. Okay, thank you, Lucy. Really, yes. Okay, perfect. So let's do this. Wonderful. Okay, thanks so much. Sometimes, what do they say? Sometimes they're black in the screen if you made a bad comment. Oh, on another live, which I haven't. Which I never make bad comments on other lives. So thank you so much for letting me know. But we can go ahead and do this for just another second or so. And this always calms me down. This relaxes so much. So we're going to do this. No, you wouldn't be one of those people that are watching, could you? I know. I watch other lives, but I never make bad comments, so we're really good. Okay, fantastic. Then let's do the best metabolism point. This point is so good. I was actually having really tough time today with, I don't know, I don't usually get constipated, but I did this point and I felt so much better. And if you could probably think about this point, what this point is that this point is Li4. Now remember, you know the rule, no hand points if you are pregnant. So don't want you to do the hand points if you're pregnant, but this is the best point for metabolism. It totally helped me out this morning. I don't know why my stomach just felt so swollen. Couldn't figure out why, but I did this point for 2 minutes this morning and it felt so good. It balanced out my GI tract. This point can also help you with toothaches, bleeding gums. This point can also help you with nausea, GERD, acid reflux. This point can help you with small intestine issues like diarrhea. This point can also and then this point can also help you with constipation, gas, bloating, hemorrhoids. This is a really good point that you can do. And Chica, I have Adam for you here. See? Here's our Adam, doing really, really good. So wonderful. I ended up getting you another Adam because I have this one when I do YouTube. So it's like, I need one near me so that I can show Adam, but all good. All right. Next point we're going to do is for hormone balance for weight loss. Now, again, hand points, you can't do it if you're pregnant, but really great hormone balance point for weight loss is right here. It is actually, you go to the web and then you fall into the ditch. That's how you're going to find this point. So this point is really good for all types of like inflammation, hormone balance, and it can help you if you feel like your hormones are low for weight loss. So you just can't do the point if you're pregnant. So we're going to do this point for just a couple of 30 seconds, 40 seconds, and I'm doing my best to go through so you guys get a feel of all these weight loss points, a good routine. Now you just saw 4 or 5 minutes in the morning while you're getting ready. It can be so helpful. So I want you to consider doing this to help you on your weight loss journey. And I have to do it too. And these points have been so helpful in balancing out my GI tract. So if you're just joining us, welcome, welcome. We are doing a 4-point protocol to help with weight loss. We went through 3 points already. This one is for hormone balance to help you so that you have available hormone for weight loss. In addition to that, we also did the best metabolism point for weight loss. We also, no hand points if you're pregnant. We also did this because the mirror image of it is fantastic for weight loss, and also it also makes you feel so good. And then we also did the top to the bottom. So acupressure, acupuncture is based on reflexology. I try to give you the best and easiest mirror images to help you on that journey. All right, next we're going to do is aches and pains, because I've been doing these lives now. Gosh, if you guys have been with me, I've been doing these lives for almost 9 months now. So are you saving this? I can save it. Or better yet, hippie chick, you can go to the YouTube channel. We are actually publishing videos, so you can just follow along with me every day. And if you miss a live, not a big deal. You've got YouTube. And better yet, on the YouTube, I'm monetized, and all that money that you guys watch goes to the free clinic in 2024. So really, really good. So let's focus on 3 different protocols to help with all sorts of headaches, all sorts of migraines, all sorts of sinus trouble, or all sorts of neck and hip and back sciatica and hip pain. So really good combination, right? The only caveat to this is you cannot do these points if you are pregnant. So what I want you to do, yeah, county girl. So yeah, if you ever miss a live, hop on over to YouTube. You've got, by the time we're done with this, you can even see, I even wrote down all the ideas that I had. We have over 100 videos we're going to publish in the next 2 months. So you're going to have plenty. And my gift is that you guys use my knowledge, my 100,000 patients that I've treated, for the very best. And also all that money from YouTube, can help me with a free clinic. So it's a win-win for everybody. So enough of me chatting. 3 points to help you with headaches, migraines, sinus trouble. Also will help you with tinnitus, can also help you with hip and back and shoulder pain, neck pain, spinal pain. So first point, even if you don't miss a live binge on the, yes, thank you so much. You're the best. Thank you. So first point we're going to do is, so I've shared this protocol with you. I love it. It really works, but you guys got to do it. You guys got to help me do it. So remember 1, 2, 3, that's the mnemonic. I'm going to have to label that 1, 2, 3 on YouTube so you guys know. So basically 1, 2, 3. So 1, 2, 3. Let me do it again. 1, 2, 3. We'll do it 2 more times because, you know, as a teacher, if I repeat it, you guys will remember. 1, 2, 3. Again, 1, 2, 3. So remember that, and let's do it together for the next 3 minutes. We'll do a minute each. And again, if you are pregnant, cannot do these points. That's a no-no. Don't do them if you're pregnant. And if you need to lose weight and you're pregnant, talk to your doctor. They have specific protocols. I know because I've helped women who are pregnant lose weight, and it's very specific, but it's all good. It's for the health of the mom and the baby. So first point we're going to do, let's do this point together for a minute. I'm keeping track, so you just got to sit down and do it with me. This point is really good for neck pain, back of the head headaches. Can also help you with jaw pain. This point is great for spinal pain. This point can help you with L3, L4, L5, S1, S2 pain. This point can help you with radiating back of the leg pain, with radiating side of the leg pain. This point can help you with even sciatica going on the front of the legs. It's rare, but can happen. This point can also help you with medial foot pain. So really good point. And you can do this point like this. Just can't do it if you're pregnant. You can go as slow or as fast. So it's just basically this point I want you to do. You can also just do this point if you're having a tough time doing this. Not a problem. So really, really good point that you can do. So I want you to consider doing this point a couple minutes, a couple times a day to start off with. Next point we're going to do is we're going to go fist on top of fist. It doesn't matter if you're righty or lefty. Go like this, or you can go like this. Not a problem. So I want you to do this, and let's do this for the next minute. And while you do this, let's wiggle the back. Let's wiggle, 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 wiggle. And again, if you're just joining this, we are here today doing a nice protocol for all sorts of headaches, back pain, neck pain, shoulder pain, spinal pain, migraines, sinus trouble, vertigo. You can't miss it. These are great points. Now you guys know the rule. This is what my 100,000 patients has taught me. If you are doing these points and you are not seeing a benefit, definitely go see your doctor. It may be something surgical. My experience has been when the acupressure, acupuncture doesn't work, it's a surgical case. But regardless, you should be checking in with your doctors. You guys know this because the doctor has your full health workup and they may need to change out medications. Things happen, right? I'm just behind a screen on social media. I'm giving you the best of my 100,000 patients. Absolutely. I've seen this stuff work over and over. But do check in with your doctor. And even if you need surgery, these points can help. They can help you prep for surgery and they can help you recover from surgery. And these points can have long-term relief, but you got to do it consistently. Really, really good. Okay, next point we're going to do, let's see, I don't think we did this because we did 1, 2, 3. So let's do this together. What is that motion for? Okay, so this motion, we are doing all sorts of hip pain, back pain, sciatica pain. We're doing spinal pain, neck pain, shoulder pain. We're also doing for headaches, migraines, sinus trouble. So we did 1, 2, 3, 1, 2, 3. So let's do this. And so let's do this, and also let's do deep breathing. I'm only going to ask you to do a few breaths. I know the deep breathing is going to help you because what it does is it pushes the blood. And when you push the blood, you get more pain relief because you have new blood in the area. Simple, right? So let's go ahead and do a little bit of deep breathing. Do it sitting down. If you're doing the live while you're driving, don't do this. Sit down, because some people with deep breathing find themselves feeling a little nauseous, but you sit down, you breathe from the abdomen, you close your mouth. So we're going to do deep breathing for 30 seconds along with this acupressure point. Everybody do it with me, sitting down. Don't do it while driving. Woo! I feel good. Do you guys feel good? How's your pain? Is it better? Put it in the chat. Let me know. Yes. Are these from what teachings? From acupressure, acupuncture, my 20 years of experience, my 100,000 patients. That's what this is all from. How do you guys feel? Put it in the chat. Come on, YouTube. Let me know how you guys are feeling. Instagram, how are you all doing? YouTube, how are you feeling? All right, let me know how you are. Which one is for headache? All three. It works. All right, sunshine. Thank you for letting me know. I'm not losing weight. Well, you also have to drink the water, exercise, walk, get 7 hours of sleep, and pick a diet that works for you, dear. But these points do work, and they definitely can help you. They definitely can help you. Wonderful. Okay, awesome. All right, I'm going to open it up for questions. So I don't have a moderator with me, so be patient. So I am ready for your questions. I even have a notebook and one of my favorite markers from the dollar store. So go ahead and put your questions in the chat. And subscribers, it's the yellow star on the lower left-hand corner on TikTok. We're going to open up the membership after Labor Day weekend. But subscribers get top priority, but I'll do my best to answer all your questions because that's how I love you. Okay, have a kiddo with a stopped up nose. Any pressure points I can use? Yes. Okay. All right, what other questions? Let's go ahead and see. Subscribers, you get top priority. It's the yellow star in the lower left-hand corner. How can you help with, let's see, I think you misspelled it. Is it neuropathy? Where's the neuropathy, dear? Can you tell me? Anxiety after public speaking. Okay. Are you giving a speech, Chica? What's going on? Talk to me. All right, I'm gonna let Chica, because she's a subscriber, I'm gonna let her answer the question. What type of talk is she doing? And then, okay, all over the feet numbness. Okay. All right, you have lower back pain? Okay. Chico, what's going on? If you can let me know, I'd really appreciate it. Okay, all right, let me answer these questions while I'm waiting for Chica. Chica's a subscriber, so I give her top priority. Let's see. Oh, wow, cool. Okay, what about trap tightness? Yes, neuropathy in the feet and tingling. Okay, you guys all have similar things going on tonight. I think it must be the working tomorrow blues. All right, let me go ahead and answer some questions. So first question we had was for a stuffed nose. What you can do for a stuffed nose is actually try this. This that can really, really help. And then this can really help. So try that. And it's for a kid, right? You can't do these points if you're pregnant, but this is the 3 emperors. You can also massage this area. This can also help. So for stuffed nose, you can do these points a couple minutes, a couple times a day. You can do it longer. And as long as you're not pregnant, you can massage the inside of the arm. You can use your fingertips, or you can also use a dry brush. All the products work with a company called Kosha, and we vetted all the products. In fact, my whole team vetted the products. And you can use a dry brush, or you can just use your fingertips. And then let's help Chica out. She's wondering anxiety. Let's see. So this is what I would say, Chica. So what I would say is, oh, you're welcome, Kim K. So yes, that brush is the best. It's the bomb. So you have a public speaking event on Saturday. So what I would do till then, because remember, acupressure, acupuncture is a therapy. So what I would do is I would get the ear seeds. Let's see, I think my ear seeds fell. Let me grab the ear seeds. Sorry, So these are the ear seeds. So you can get them on the second link in the bio. I actually put some on that were a little bit of a crystal. I don't know if you guys can see, but I'm going to show on YouTube right there. I'm going to show on Insta, and then I'm going to show on TikTok. So I put the seeds on. Those are the ones with the crystal. I actually put it on because it's going to be a heavy week. I work as a hospital administrator for one of the biggest hospitals here in Washington, D.C. So I put them on for myself. So this can really, really help. The dry brush and these you can get on the second link in the bio. So all the products, I work with a company called Kosha. As you can tell, I vetted the products. I purchased them myself. I don't get any kickback. So other than what Amazon gives, I guess they're 8%. So I want you to consider doing these things. This is the dry brush. These are the ear seeds. But for Chica, get yourself some Acupressure. Put it on ear shen men, and then do that and do this point a couple minutes in the morning, and then a couple minutes in the evening. I want you to do this. So morning, do this, and evening, do this. Each point, do a minimum of 2 minutes, and keep me posted and come on here every night and do the acupressure. I want you to visualize succeeding, because you will succeed. I know. Okay, fantastic. And then Chica, let me know if you have any other questions, dear. You're really important to me. All over feet numbness, as long as you're not pregnant, you can do 1, do this point, and then 2, do this point. Actually, just do 1, 2, 3. 1, 2, 3. Again, 1, 2, 3. So do that point for all over feet numbness. Just can't do the hand points if you are pregnant. Yay, Chica. Low back pain, best point that I've seen. We're actually going to release a video on this tomorrow. We'll see. I gave my videographer 4 or 5 videos today, so I was on it. There's some really good stuff. There's some really cute stuff. So what I want you to consider doing is go to the YouTube channel too. There's some really, really good stuff that if you don't make the live, you can do. And again, all my YouTube money, I'm monetized. There's commercials. I'm really sorry, but all that money goes to Free Clinic in 2024, which all of you are going to come and check out and participate. It's going to be great. Okay, so we have high blood pressure. I need to do a video on this. I was realizing because I don't think I have one. So for high blood pressure, it's just this point. Do this point and do it all throughout the day. It'll calm you. It's also a really good anxiety point. And then also cinnamon tea is super great. You can read the PubMed research on it. I need to figure out a way to publish, to show you all the research that I'm doing so you can see it. But that is cinnamon tea, hibiscus tea. Just be careful with the hibiscus tea if you're pregnant. I would talk to your doctor. I personally wouldn't drink hibiscus tea if I was pregnant, but cinnamon tea, you can drink a few cups. If you're not quite sure, just talk to your doctor. Your doctor can advise you correctly. And then also, this is a really good point for helping you with high blood pressure issues. Really simple to do. It's just basically the rim of the ear. You massage the rim of the ear. So simple that you can do this. Really, really good. Okay, and then we had a gal ask about getting pregnant. You know, really the 2 things, actually the 3 things that I've seen that, how do you prepare the cinnamon tea? Simple. You get Ceylon cinnamon. You can get it at Walmart. I've seen it at Walmart. I live across the street from Walmart, so it's kind of like my kitchen. I think of Walmart like my storage unit, which I shouldn't do. But you take Ceylon cinnamon. You can just brew it to your taste, and then you can put a little bit of honey or agave and drink it, and that could work really well. Okay, so we have a bunch of questions. And again, subscribers, you get top priority. So how do you become a subscriber? You hit the yellow star on the lower left on TikTok, and we're going to open up the membership on YouTube. So hang tight, my YouTubers. You will get to be a member in after Labor Day. So we had heel pain. For heel pain, as long as you're not pregnant, you can massage. This represents the heel. So you can massage this for, remember, all the points, minimum 2 minutes. You can do it longer if you want. Then also, what you can do, I lost the ball. So what you can do is for heel pain, while you're doing this or coordinated with it, I want you to do this as long as you're not pregnant for heel pain. And then I want you to take a hard ball, like a tennis ball or lacrosse ball or golf ball, and massage out the heel. It'll bring new blood flow and you won't have heel pain. Endometriosis pain, you can drink cinnamon tea. Cinnamon tea can help. Also, this is a great point for endometriosis pain. This actually mirror images the entire uterus. So this is a great point for endometriosis pain. We had a gal ask here just a little bit on how to help with getting pregnant. So I wanted to cover this real quick. You're welcome, dear. So the 3 things that I've seen in clinic, I've been treating fertility for a long, and again, I do it alongside their physician, because we need a family to do this, right? Oh, thank you, Sophia. Thank you so much. Thank you. All the social media money goes to the free clinic, so I really appreciate you. Thank you so much. So if you're trying to get pregnant, these are the things that I've seen. It's difficult with ovulation. It's also difficult with regulating a cycle. It's also difficult with implementation of the embryo onto the uterine wall. These are the things that I've noticed in clinic. So the best points that you can do to prepare. So, and if you go to the YouTube channel, there's actually a course, a 30-day course that I filmed last year. It's totally free. And you're going to help me by watching it because I'm educating you. In addition to you helping me out, the money that I get from that, I put towards a free clinic. So it's a win for you and a win for me. But what you can do is view that course. And in a nutshell, if you can do this point, this helps so much because the fingers represent the fallopian tubes. The fingers will promote ovulation. This represents the uterus. So this will help you to build blood and also to regulate the cycle. This will also help you with implementation. So the moment you feel like you want to get pregnant, or if you're struggling, go work with your doctor and do this point. I want you to do this point a couple minutes throughout the day. And once you are pregnant or once you have an embryo transfer, either if you're pregnant or once you have an embryo transfer, stop. You've done enough. Let the body do what it needs to do. And of course, work with your doctor. If you're not sure, ask your doctor because your doctor can give you advice and that would be best. Okay, so we have a few cases where people are asking about low back pain. Low back pain, remember, 1, 2, 3. 1, 2, 3. So you're going to do, as long as you're not pregnant, no hand points and no foot points if you're pregnant. I'm really good about telling you guys. But if you have low back pain, you do this point for a couple minutes. You do this point for a couple minutes. Then you do this point for a couple minutes. So remember, 1, 2, 3. So 1, couple minutes, 2, couple minutes, and 3, couple minutes. So I want you to do that. Can't do these points if you're pregnant, but can help you with all sorts of back points. And then any points to get a stronger pelvic area? Yeah. Can you tell us your YouTube? Yes, YouTube is the same name. It's the same name on all the platforms. So just do Empirical Grace. Just so you guys know, empirical means evidence or by experience. And Grace is actually my namesake. And then acupuncture is acupuncture. So it's Empirical Grace, the same name. So yes, for a stronger pelvic, you want to do this point. So what it is on the forearm, on the thumb side, you want to massage this. But you can't do this point if you are pregnant. So keep that in mind. So whenever low back pain, trap tightness. So what you can do for trap tightness is a couple of things. You can do this point. You can do this point. I want to show on all platforms. I'm on 3 right now. So we're going to do this point. And then in addition to this point, you cannot do this point if you're pregnant. So if you're pregnant and you're having trap pain, go see an acupuncturist. Google has some really good reviews on acupuncturists. Also, the medical board can also recommend, all medical boards in the state of Virginia. I'm licensed by the medical board. So same as doctors. So you can check and find a really good acupuncturist in the medical board too. So as long as you're not pregnant, well, you can do it again. All the tools are on the second link. I vet them because I have one right here. What you're going to do is you're going to massage like this, as long as you're not pregnant. And that can help you release the traps. But first do this point, then use the tool and release the trap. Okay, so for shoulder, simple thing you can do is this, or you can go 1, 2, 3. That's my go-to. 1, 2, 3. That's my go-to. Just can't do it if you're pregnant. All right, you guys, I got more YouTube to film tonight so that I can help all of you. I'm really happy you all are here tonight. So let's do 2 points to help you sleep well tonight, okay? Everybody, these are really good points. Everybody put their phones down. Let's do these points together. What can be good for vertical? I get really bad dizzy spells at the point that throw up. Oh, Esmeralda, I really need to do a YouTube video on this. As long as you're not pregnant, you can massage this point. This point is really good for that. This point is really, really good for that, as long as you're not pregnant. Hey, Chica, are you doing okay, dear? All right. So yeah, of course. Okay, 2 points, everybody. It's going to help you sleep well tonight. And also, what helps jaw clenching? You can actually you can massage the jaw before you go to bed, and that actually relaxes the blood flow to the jaw, and it's called a post-hypnotic suggestion. It'll help you sleep. For diabetes, you can do 2 points. Just can't do these points if you're pregnant. So you would do triple warmer 3 right here, and you do spleen 4. Just can't do the points if you're pregnant. If you're pregnant and you have diabetes issue, you got to work with your doctor. Talk to your doctor about cinnamon tea. I've seen patients have really good results with that. Okay, what high blood pressure? Let's see. Wow, you guys are really coming in with the questions now. Okay, neck pain. You can do this point on the wrist. The wrist represents the neck. Just can't do the points if you are pregnant. All right, you guys, let's do 2 points. I got to film more YouTube tonight, and check out the YouTube. There's daily videos, and I really want to build a library. So if you're like, I missed her live, I'm not quite sure where to go, you can go to YouTube and you can go ahead and watch it. So let's do 2 points to help you sleep tonight. First point, we're going to do a minute each, and you're going to turn off TikTok. Maybe lay in bed, watch my YouTube, and go to sleep. First point we're going to do is just do this point. I love this point because you know why? The entire body is managed right here. Really, really good. So I want you to do this point. And let's do this point for just another 30 seconds. See how good you must feel. See how good you may feel. Let's do this point for just a little longer. Okay, really good. Next point, best point for sleep. You want to see my Halloween skull I got at the dollar store? I love the dollar store. I go to the same one that I've gone to since I was a kid. Can you believe that? So maybe not on him. Do you want to call this guy Adam? What do you guys think? Is this Adam 2.0, or should we name him different? You guys let me know in the chat. Should we call him Adam or something totally different? So, okay, let's go back to this one. So, what is my YouTube? Okay, you want to call Adam, that's this is 1.0, that's 2.0. Okay, and then YouTube is the same name. YouTube is Empirical Grace. So it's the same name as Insta, and same name as Facebook, and the same name as TikTok. So you want to get this guy, this point right here. No, not Adam, Chica. What do you want to call him then if it's not Adam? Edgar. Let's call him Edgar. You guys want to call this guy Edgar? What about Edgar? Edgar. I kind of like the name Edgar, but you guys let me know. But let's go back to the sleep point. So mastoid process, inferior medial. Okay, Edgar it is. All right. Okay. So on Adam, Milo. Okay, let me know if you want Milo or Edgar in the chat, please. So getting back to the sleep point, because I had to get you to sleep, but I'm glad you're laughing because it's good. So lower medial corner, right behind the ear, that's the mastoid process. What we're going to do is you're going to grab behind the neck, and then you're going to massage. Let me try to show you guys. So you're going to go behind the neck and hit the bone, and the tender spot, that's the spot, and you're going to massage that point. It's going to feel so good, and it's going to help you. Hey, how's it going? So before I forget, what do you guys want? You want Edgar and Milo for the other skull? Can you guys let me know? If you're just joining us, welcome. I name my tools that I use on here. So I want to ask you guys, do you want Edgar or Milo? Okay, we'll go with Edgar. All right, Edgar, it is. And then we have a question. Let me make sure. Thank you, Chica. I'm a 42-year-old in the past 3 years and I had miscarriages. Okay, let me give you a good acupressure point. Hang with me. Let me give you a good one. Let's just do this for another 30 seconds. And then, oh, on YouTube, they want Edgar too. All right, we are. I don't know even how. My first skeleton in acupuncture school, we named Elmo. Do you guys want Elmo or you want Edgar? Can you guys put in the chat Elmo or Edgar? Let me know Elmo or Edgar. Whew. Okay, really good. Let me help this one gal out. While I'm helping this one gal out is, let me know in the chat if you want Elmo or Edgar for the skull. Okay, so we have a gal who, Freddie, okay. So we have a gal, she asked about miscarriage and what to do as far as acupressure. So you know to consult with your doctor. You know, these are just helpful tips, but I don't know what's going on. So really work with your doctor. Two things I can say that actually three things I can say with miscarriages that I've seen in the clinic. You know, obviously, number one, we cannot underestimate stress. So, you know, as best as you can, manage the stress. The acupressure is great because it releases endorphins to help you feel calmer. Watch, you know, if you can, please also, please watch the caffeine because caffeine can also cause miscarriages. So work with your doctor on what the right caffeine dosage is. And then the other thing too is there's some points right above the knee. So we have Adam here, and then above the knee, it's right above the knee. If you massage right above the knee, that can help, but do work with your doctor. All right, you guys, I think Edgar wins out. So you guys have a great week. I'm totally excited about this week, even though it's going to be a heavy week at work because it's Labor Day weekend this weekend and I can put my feet up. So you guys have a great week. I'm sorry if I'm a little late to the lives, but I do my best. And if you have a question and you don't know where to go, you know, work with your doctor and check out the YouTube. It's got really, we're going to publish 100 YouTubes in the next 30 days. So it's going to be really exciting. And we want to build a library so that I can serve all of you. And all that money that I get from YouTube, I'm putting towards a free clinic, which I'm going to invite all of you to be with. So really good. Have a great week. And I'll see you guys here tomorrow night. Get some good rest. I love you all. Bye-bye.